Mr. Briggs, you are now recognized.
Yeah, sorry. Chairwoman Maloney, Ranking Member Comer, members of the House Committee on Oversight and Reform, please allow me to thank you to testify before you today. And just a point of correction, I do, in fact, live in Northern Virginia and I am a patient advocate, but I also am Public Affairs Counsel for Independent Institute, which is a think tank in Oakland, California. In November 2015, my wife got the most dreadful call a parent can get. The doctor knew why our daughter, Colette, then 2.5, hadn't been feeling well. Blood work had revealed leukemia, cancer. We raced Colette to Inova Fairfax Hospital, the only one in Northern Virginia where we live that treats pediatric cancer, and got there just in time. Thanks to Obamacare, we were already in difficult straits regarding health care. In 2014, that law had eliminated a plan we had had for years. Before the ACA went into effect, the private marketplace consistently and reliably had offered us a wide variety of inexpensive plans that covered specialist care, even out of state. After the ACA went into effect, however, all that was left were increasingly costly plans with fewer benefits, including fewer doctors and fewer hospitals. Thanks to Obamacare, we were and still are to this day basically restricted to medical facilities within a short radius of our zip codes. Obamacare, in a word, has made us into medical serfs. We're tied to the land on which we live, unable to leave it even to save a little girl dying from cancer, which is why when we tried to take Colette to Johns Hopkins, just up the road in Baltimore, we were denied. Under our pre-ACA plan, which didn't geofence sick children from the care they deserve, she would have been admitted. Our predicament was made all the more painful by swelling premiums, as well as by skyrocketing deductible and maximum out-of-pocket expenses. They can go as high as $16,500, as it has been for my family. But things were about to get much worse than expensive for our family. In mid-2017, President Trump merely suggested the scrapping of the massive Obamacare payments to insurance giants, which were delivering worse care at ever greater cost. And in response, because Obamacare for some reason permits this, every insurer in Northern Virginia with a family plan, including the one we had, pulled out for the following year, 2018, except one. Cigna Connect, however, wouldn't cover my daughter at Inova Fairfax, the one hospital in Northern Virginia, as I say, with a pediatric cancer ward. So under Obamacare, our daughter was effectively without coverage for cancer. Not the common cold or a broken bone, but cancer. We went through another terrifying event in 2020. In mid-March of that year, with COVID sweeping the country, Anthem, the plan we had for that year, announced suddenly that on April 1st, it would no longer cover not the hospital this time, but the clinic, where she received most of her doctor-administered chemotherapy. So we called the marketplace. Perhaps it would grant us a waiver to buy the Cigna plan still available for sale in our zip code. Not a chance, we were told. The failure of the ACA to cover our daughter battling a terminal illness was not considered, we were told, a qualifying event. So once again, thanks to the ACA, we were left without coverage for our daughter recovering from cancer at the clinic, the only one she could go to in Northern Virginia. Now, in both cases of systems collapse, we were forced to turn to the author of these failures, that is, to the government, to all of you. Specifically, we had called Senator Mark Warner from Virginia, one of our senators, so he could bully a private company, Cigna in the first instance and Anthem in the second, into covering respectively the hospital and the clinic. And in both cases, the threats from the state drove the insurance giants back into the marketplace. But I do hope all of you can see how these successes that I achieved were actually failures. Ad hoc exercises of government power to ensure proper functioning of the ACA means we are not dealing, despite the rhetoric, with a marketplace, but rather with a closed web of insurance companies and medical providers at the mercy of the police powers of a complicit government. Now, perhaps to solve the instability of Obamacare, which is inherent to it, the government could just take over all medical facilities. But everybody in the country at that point would be at the mercy of the same government bureaucracy that has been brutalizing my daughter and her parents for years. The high costs of Obamacare would go higher. The rationing of care that we've already experienced will be even more pronounced, and here's why. It's very simple. Bad ideas don't get better just because you make them bigger. They get worse. Twice in a 3-year period, the most important problem that we faced wasn't high costs, as bad as they were, but the terrifying reality that high prices in a planned, closed economy always signify that we are on the way to scarcity. Twice in 3 years, we found ourselves with no insurance product to buy for any amount of money that could save a little girl battling cancer. And here's the thing that's the main point of what I want to say. Scarcity doesn't go away under universal coverage or single payer, whatever word we want to use this week or next week to describe it. Under full government control of the body, that is, under full government control of the body by all of you, scarcity wouldn't be, as it is in my case now, circumstantial. My family was effectively a canary in the coal mine. Scarcity under such authoritarian medicine becomes policy. And by that I mean this. Those long wait times that everyone can read about for cancer screenings in Great Britain or Canada, that is scarcity made institutional, universal, but in a very bad way. And if you want an example closer to home, try the government-run hospitals of the Veterans Administration, where people die in line waiting for care. In other words, if we unfortunately get more managed care from all of you, the government, my daughter will be everyone's daughter. And every mother and father will experience what my wife and I have experienced. We watched our daughter battle cancer while the institutions of medicine, thanks to the ACA, colluded with a disease against her. There is one correct long-term answer in my view. We must prohibit the government, that is to say all of you, from further interfering in the acquisition by private citizens of their preferred medical care. And we do that by a repeal of the ACA and placing back into the hands of Americans real, actuarially sound, automatically renewable insurance products curated to individual needs. That is the kind of universal coverage this country deserves because it's the only kind that works. And now a word for my Republican friends. Obamacare, as you may know, has very little to do with actual insurance. It is essentially a giant scheme, some would say, I would say, a giant Ponzi scheme to pay for each other's medical bills. And since my daughter, thanks to the ACA, got very, very sick under a non-insurance regime, she is now permanently uninsurable. If we ever come to our senses in this country and give back to the citizens real insurance, my daughter will never be able to have one, and here's the logic. You cannot buy auto insurance after the car accident. My daughter managed to get sick with cancer. She's had that accident. She is permanently uninsurable. However, if I'd been allowed to keep my pre-ACA plan, as President Obama promised, things would be very different. My daughter today would have insured durable access to medical care. In essence, Obamacare turned an insurable illness, one as grave as cancer, into a permanent pre-existing condition from which my daughter will never escape. But my daughter's not alone. Millions of persons have gotten sick under Obamacare, and everybody in this room, in this entire country, will someday suffer a serious illness, such as, we'll call it fate for the purpose of this discussion. And soon enough, the number of permanently uninsurable will be so large that you won't be able to repeal Obamacare. Obamacare, in a word, is creating right now a nation of pre-existing conditions. The Democrats know this. All they have to do is wait, and we will be forced into a full state takeover of the body. So how about it? When you Republicans get into the majority, you win both houses and possibly get the presidency back, will you give us back our bodily autonomy and repeal this law? Your doing so, however, won't help my daughter. For her, it is too late. She and the other victims of Obamacare will need government health care for the rest of their lives. But the rest of us, and for those yet unborn, it is not too late. And to put this another way, and this may sting, but when you come back into power, please, for the love of God, no more Paul Ryan-style tax cuts, which the other side will just eliminate or destroy by inflation as they're doing now. The state takeover of the human person by authoritarian control of medicine is far more worthy of your attention than any tax cut, no matter how deep. I thank both sides for the time given me to air my concerns.